Hi, so in this video we're going to demonstrate movements of the pelvis, the ribs and the skull in the sagittal plane, or a forwards and backwards motion. I'm going to use the pelvis here just to demonstrate. So if we use your pubic bone here at the front as a reference point, when you're lying on your back, which we will be in a second, you're going to begin with tilting your pelvis backwards. So you're bringing your pubic bone up towards your chin, or up to 12 o'clock in the clock face. And then we're going to let your pelvis roll forwards. So we'll begin with that, and then we'll incorporate the skull, the ribs, and breathing as well into that. So if you lie on your back with your knees bent, now you might need a pillow to support you. So knees are going to be bent, and you can let your hands just rest down by your side. You can actually let them rest onto the bones of your pelvis here at the front. So first of all, what we'll do is we let the pelvis rock backwards, so up towards your chin, or up to 12 o'clock. When this happens, you should feel the bones of your back making contact, and the knobbly parts of your back making contact with your mat, all right? Then you're going to let your pelvis tilt forward. So just get into that movement first of all, the forwards and the backwards movement of the pelvis. So from here then we'll incorporate some breathing. So if you take a breath in, as you're breathing out, let the pelvis tilt back. And at the same time, we're going to let the chin lift. And you'll notice that when the chin lifts, you might find that you have more contact with the joints of your lower back. So we'll breathe in now, and we'll tilt forwards on your in breath. So when you're tilting forwards, there's going to be an arch happening in your lower back, and the chin, we're going to rock it forwards. So the chin is going to rock forwards, the pelvis tilts forwards. Breathing out, we're bringing the pelvis back, chin lifts. So breathing in, coming forwards, breathing out, tilting back, and the chin lifts. So from here we'll bring the ribs into it as well. So starting from a neutral spine, breathing in, take a breath in and let your pelvis tilt back, and we're going to let the ribs drop down. So the rib cage is going towards your pelvis, and we'll let the chin lift to allow that to happen a little bit better. And then we'll breathe in, and we'll come the opposite way. So the ribs are going to lift, the chin comes down, pelvis tilts forwards. Take a breath in here, breathe out, tilt back, chin lifts, ribs are down. You'll feel your abdominals maybe starting to work here. Breathe in, tilt forwards, let your chin come down, breathe out, tilt back. And again, breathing in, coming forwards, and breathe out, coming back. And let the ribs come down.